Hello, I'm Dr. James Quintin, an oncologist, and today I want to talk about something extremely important that many people ignore until it's too late. Colon cancer is one of the most common cancers in the world. What makes it dangerous is not just the disease itself, but the fact that it often grows silently for years before people realize something is wrong. Many of my patients tell me the same thing when they finally come to see me. They say, "Doctor, I noticed some small changes in my body, but I didn't think they were serious." Unfortunately, those small changes are often the early warning signs your body gives when something is wrong. The good news is that colon cancer is one of the most preventable and treatable cancers when detected early, but that only happens if people understand the warning signs and take action. In this video, I will explain the first warning sign of colon cancer many people ignore, why colon cancer happens in the first place, the foods that may increase or reduce your risk, and the most important steps you can take to prevent it. If you stay with me until the end of this video, you will have a much clearer understanding of how to protect yourself and your loved ones. What is colon cancer? Before we talk about warning signs, it's important to understand what colon cancer actually is. The colon, also called the large intestine, is part of your digestive system. Its main job is to absorb water and nutrients from the food you eat and to help remove waste from the body. Colon cancer begins when abnormal cells start growing inside the lining of the colon. These abnormal cells often start as small growths called polyps. Most polyps are harmless at first, but some can slowly turn into cancer over time. This process can take several years, which is why early detection is so important. If cancer cells continue to grow unchecked, they can spread deeper into the colon wall and eventually to other organs such as the liver or lungs. That is why doctors emphasize early screening and recognizing warning signs. The first warning sign of colon cancer. One of the earliest and most common warning signs of colon cancer is changes in your bowel habits. Many people experience occasional digestive changes. That is normal. But when these changes become persistent, they should never be ignored. Here are some examples of bowel changes that may signal a problem. You may notice frequent diarrhea or constipation that lasts for several weeks. You might feel like your bowel never completely empties after using the bathroom. Some people also notice that their stool becomes narrower or thinner than usual. These changes may not seem serious at first, but when they continue for weeks, they can indicate that something inside the colon is interfering with normal digestion. Sometimes a growing tumor inside the colon partially blocks the passage of stool. As a result, the stool may appear thinner or irregular. Another early warning sign that often appears with bowel changes is blood in the stool. This blood may appear bright red or sometimes darker, depending on where the bleeding occurs in the digestive tract. Many people assume that blood in the stool is caused by hemorrhoids, and while that can be true, it is always important to have it evaluated by a doctor. Ignoring persistent bleeding is one of the biggest mistakes people make. Why colon cancer happens. Now that we've talked about the first warning sign, let's discuss why colon cancer develops in the first place. Cancer does not appear overnight. It usually develops over many years due to a combination of factors. Some of these factors are related to age and genetics, while others are strongly linked to lifestyle and diet. One of the biggest risk factors is age. Most colon cancer cases occur in people over the age of 50. However, in recent years, doctors have noticed a rise in colon cancer among younger adults as well. Another important factor is diet. Diets high in processed foods, red meat, and unhealthy fats may increase inflammation in the digestive system. Over time, this inflammation can damage the cells lining the colon and increase the risk of abnormal growth. Lack of physical activity is another major contributor. Regular movement helps your digestive system function properly, while a sedentary lifestyle can slow digestion and increase cancer risk. Obesity, smoking, and excessive alcohol consumption are also known to increase the likelihood of developing colon cancer. Family history can also play a role. If close relatives have had colon cancer or certain genetic conditions, your risk may be higher. But the important thing to remember is that many colon cancer cases are preventable with the right lifestyle choices and early screening. Now that we've discussed the first warning sign of colon cancer, let's talk about other symptoms that people often overlook. Many of these signs can appear gradually, and because they may seem mild at first, people often ignore them. But recognizing these signals early can make a huge difference. Warning. Sign number 2, Blood in the stool. One of the most concerning signs of colon cancer is blood in the stool. Sometimes the blood appears bright red, especially if the bleeding is happening in the lower part of the colon or rectum. In other cases, the blood may appear darker or even black, which can indicate bleeding higher in the digestive tract. Many people assume this is caused by hemorrhoids, which are swollen veins near the rectum. While hemorrhoids can cause bleeding, it is never safe to assume that is the only cause. If you notice blood in your stool more than once, or if it continues for several days, it is very important to speak with a healthcare professional. Early evaluation can help identify the cause and rule out serious conditions. Warning sign. Number 3. Unexplained weight loss. Another common warning sign of colon cancer is unexplained weight loss. Many patients are surprised when they lose weight without trying. You might notice your clothes becoming looser, or the number on the scale dropping, even though your eating habits haven't changed. This happens because cancer cells consume a large amount of the body's energy. As the body tries to fight the abnormal cells, metabolism can change and lead to sudden weight loss. If you lose a significant amount of weight without changes to your diet or activity level, it should never be ignored. Warning, sign number 4, persistent fatigue. Fatigue is another symptom many people overlook. Everyone feels tired occasionally, but cancer-related fatigue is different. It often feels like a deep exhaustion that does not improve with rest. One reason this happens is that colon cancer can cause slow internal bleeding. Over time, this blood loss may lead to iron deficiency anemia. When the body does not have enough healthy red blood cells, it cannot deliver oxygen efficiently throughout the body. This can cause symptoms such as weakness, shortness of breath, pale skin, constant tiredness. If fatigue becomes persistent and unusual, it is important to investigate the cause. Warning. Sign number 5, abdominal pain or cramping. Some people with colon cancer experience persistent abdominal discomfort. This may feel like cramping, bloating, or pain in the lower abdomen. When tumors grow inside the colon, they can partially block the movement of stool and gas through the digestive system. This blockage may lead to pressure, swelling, or discomfort in the stomach area. Some patients describe the sensation as feeling constantly bloated or having stomach cramps that do not go away. If abdominal pain continues for several weeks, it should be evaluated by a doctor. Warning. Sign number 6, feeling that your bowel never fully empties. Another symptom that many people ignore is the feeling that the bowel does not fully empty after using the restroom. Even after having a bowel movement, you may feel like you still need to go. This sensation can occur when something inside the colon is blocking normal movement. Sometimes tumors in the rectum or lower colon create this feeling of incomplete evacuation. If this sensation becomes frequent or persistent, it should not be ignored. Foods that may increase colon cancer risk. Now let's talk about diet. What you eat plays a significant role in the health of your digestive system. Certain dietary habits may increase the risk of colon cancer over time. One of the biggest risk factors is excessive consumption of processed meats. Processed meats include foods like bacon sausages, hot dogs, deli meats. These foods often contain preservatives and chemicals that may damage cells in the digestive tract. Diets high in red meat, especially when cooked at very high temperatures, may also increase cancer risk. Another concern is a diet low in fiber. Fiber helps move waste through the digestive system and supports healthy gut bacteria. Without enough fiber, digestion slows down, and harmful substances may stay longer in the colon. Highly processed foods, sugary drinks, and excessive alcohol consumption may also increase inflammation in the digestive system. Over time, chronic inflammation can damage the cells lining the colon. Foods that support colon health. The good news is that certain foods can help support colon health and reduce cancer risk. Foods rich in fiber are extremely beneficial. These include whole grains, oats, beans, and lentils, fruits such as apples and berries, vegetables like broccoli and carrots. Fiber helps promote regular bowel movements and supports healthy gut bacteria. Leafy green vegetables are also excellent for colon health. Spinach, kale, and other greens contain nutrients that support healthy cell growth. Another important group of foods includes those rich in antioxidants. Antioxidants help protect cells from damage caused by free radicals. Foods high in antioxidants include blueberries, strawberries, nuts, green tea, Healthy fats, such as those found in olive oil, avocados, and fish, may also support overall digestive health. A balanced diet combined with regular physical activity can significantly reduce your risk of colon cancer. In the next part of this video, I will explain the most effective ways to prevent colon cancer, when you should get screened for colon cancer, the test that can detect colon cancer before symptoms appear. These are things every adult should know, especially after the age of 45. Now that we've discussed the warning signs and risk factors, the most important question becomes, how can colon cancer be prevented? The encouraging news is that colon cancer is one of the most preventable cancers when people take the right steps early. Doctors around the world emphasize prevention because many colon cancers develop slowly over time. This means there is often a window of opportunity to detect abnormal growths before they turn into cancer. Let's talk about the most important steps you can take to protect your colon health. Prevention. Step number 1. Eat a colon-friendly diet. Your diet has a powerful influence on your digestive system. A healthy colon benefits from foods that are rich in fiber, nutrients, and natural antioxidants. Fiber is especially important because it helps move waste through the digestive system more efficiently. When waste remains in the colon for long periods, harmful substances may have more time to interact with the cells lining the colon. Foods that are rich in fiber include whole grains such as brown rice and oats, beans and lentils, fruits like apples, pears, and berries, vegetables such as broccoli, carrots, and leafy greens. Another group of beneficial foods includes those rich in antioxidants. Antioxidants help protect cells from damage and reduce inflammation. Foods high in antioxidants include blueberries, strawberries, tomatoes, green tea, nuts, and seeds. Healthy fats can also play a positive role in supporting digestive health. Examples include olive oil, avocados, fatty fish such as salmon and sardines. These foods contain nutrients that support overall health and may help reduce inflammation. Prevention. Step number 2. Maintain a healthy weight. Maintaining a healthy body weight is another important step in reducing colon cancer risk. Obesity has been linked to a higher risk of several cancers, including colon cancer. Excess body fat can increase inflammation in the body and may influence hormone levels that affect cell growth. Even small lifestyle changes can make a difference. Simple habits such as walking daily, taking the stairs, reducing sugary drinks, eating balanced meals can help improve overall health and support digestive function. Prevention. Step number 3. Stay physically active. Regular physical activity is strongly associated with a lower risk of colon cancer. Exercise helps stimulate digestion and keeps the digestive system functioning efficiently. Physical activity also helps regulate insulin levels and reduces inflammation in the body. You do not need to perform intense workouts to benefit from physical activity. Even moderate activities such as brisk walking, cycling, swimming, light strength training can significantly improve overall health when done consistently. Prevention. Step number 4. Limit alcohol and avoid smoking. Smoking and excessive alcohol consumption are both associated with increased cancer risk. Smoking introduces harmful chemicals into the body that can damage cells and contribute to cancer development. Alcohol, when consumed in large amounts, can also irritate the digestive tract and increase inflammation. Limiting alcohol and avoiding smoking can significantly reduce the risk of many types of cancer, including colon cancer. The most important step: colon cancer screening. While lifestyle changes are important, screening remains one of the most powerful tools for preventing colon cancer. Screening tests allow doctors to detect abnormal growths called polyps before they become cancerous. One of the most effective screening methods is a colonoscopy. During this procedure, a doctor uses a thin, flexible tube with a small camera to examine the inside of the colon. If polyps are found, they can often be removed during the same procedure. This means colonoscopy does not only detect cancer early, it can actually prevent cancer from developing. Most medical organizations recommend that adults begin colon cancer screening around the age of 45. However, people with a family history of colon cancer may need to begin screening earlier. Your doctor can help determine the best screening schedule based on your personal risk factors. When should you see a doctor? If you experience any of the symptoms we discussed earlier, it is important to seek medical advice. You should consider speaking with a healthcare professional if you notice
persistent changes in bowel habits, blood in your stool, unexplained weight loss, ongoing abdominal discomfort, fatigue that does not improve with rest. These symptoms do not always mean cancer, but they should never be ignored.
Early evaluation can provide peace of mind and, if necessary, allow treatment to begin at an early stage. Final message. Colon cancer is a serious disease, but it is also one of the cancers where knowledge and awareness can save lives. Understanding the early warning signs, making healthy lifestyle choices, and participating in regular screening can significantly reduce your risk. Your body often sends signals when something is wrong. The key is to listen to those signals and take action when necessary. If this video helped you better understand the warning signs of colon cancer, consider sharing it with friends or family members who may benefit from this information. Raising awareness can help more people recognize symptoms early and seek medical care sooner. Thank you for watching, and remember, detect cancer early. Save your life.